Thank you for joining us today. We have two special guests, and they're from WestCare Village South. And thank you very much, Dustin, for being here, and Gloria. Folks, you're going to want to stay tuned because we have some very interesting information here. Whether you're going to be involved with it, surely somebody you know is going to need your care. So let's talk first about WestCare nationally, and then we're going to get right to local. So why don't you tell us about WestCare?
Yeah, so WestCare is a national organization and been around since 1973. What we find is very unique about us is we're not like some other agencies that might be nationally, where whatever you get in South Florida could be the same that you get in Minnesota or Iowa. What you're going to see with WestCare is we're going to really meet whatever that community need is. So what's happening in Florida could be different than what's going on in California. And here, actually in Florida, we have 3 separate entities that are part of WestCare. We have one in the Keys.
Hold on for 1 sec. Tell everybody right now, big picture, what does WestCare do?
Health and Human Services. So we provide behavioral health services. Down here, it's going to be more geared towards foster care, women and children with substance use disorder. We're going to provide very unique is outpatient services in-home on-site. So individuals will be able to, instead of having to come to our facility, we're actually going to go out to them. That really helps for the individuals that we're serving. A lot of them may not be able to get transportation to an office. So we're able to go out to where they are, and really helps, it helps them by saving them from having to catch a bus or catch an Uber.
So you help people that have a drug problem, alcohol problem, mental health, which doesn't mean you have to be schizophrenic. It just means that you've got some social problems that are stopping you.
Right. I think another big one is a crisis response team. So if someone is suicidal or homicidal, we are the entity that shows up within 60 minutes to help you.
That's pretty important. We know this. We were talking earlier about autism. 4 or 5 years ago, this woman out in Kendall, she had her baby who was autistic. She threw the baby in the canal. A neighbor saw the baby in the canal, rescued the baby, handed it back to her. And 2 blocks later, she did it again. So here's this lady obviously having a crisis, didn't know quite what to do.
Right.
And so she just didn't know what to do at the time. So if somebody's having a crisis, they know it internally. What do we want them to do? Put the phone numbers up if you don't mind. What do we want them to do?
We want them to call 1-800-HELP-YOU. You're going to be connected right away with a master's level clinician. And then as Gloria mentioned, within 60 minutes, we're going to have a team of a therapist, behavioral health technician, and a peer that is going to be out there and able to provide the services and also link them to any additional services that they may need.
About 3 years ago, a friend of mine called and he goes, "Michael, my son just pulled a knife on me." The boy is, and it was 17 or 18, pretty big kid. I said, "So what did you do?" He told me what he did. I said, "I have a phone number." I give him the phone number. At that point, the police are there. Really a disaster. A year later, the 2 of them were here. They didn't know each other, but I knew. And so I didn't introduce them, but I started bringing up the business that he was in. She recognized the business. They said, and it was to see them have that hug, it was tremendous. And that saved that family. There's no question that helped this young man, get through. And he's on a master's level program now, so good for him. So way to go. So again, let's talk about you take care of women, pregnant women, single women, drug problem, alcohol problem, women with babies. How crushing is that for you? Forget you for a second. How crushing is that for you, Mom?
It's not crushing. It's important. It's important to know that someone is in your corner. A lot of times as a mom, you get overwhelmed, right? This baby is crying. You have to work. You have to do all these things, and you never know who to turn to. And that's us. That's what we're here for.
So let's talk a little bit about funding. How does WestCare get money, all right? And let's talk about something that's going to happen in 2027 here in Miami-Dade County so people here can feel a little more comfortable.
Yeah, so we have a lot of contracts that we contract with in Broward County. We have a partnership with Broward Behavioral Health Coalition, and they provide us funding where we have our women and children's facility in Pembroke Pines. So that's one of our major funders. And then another major funder would be right here in Miami is Thriving Mind. So they provide funding for our mobile response team, as well as a lot of our outpatient services, which are in-home on site. And then as of July of 2025, we are the newest full case management agency for families in the child welfare system, and that's funded through Citrus Family Care Network.
So in June 26th, just a few months ago, there was an announcement by Miami-Dade County. Tell us about that.
About the CBO dollars?
Yes.
You know, it doesn't impact us directly, but it is going to impact a lot of providers in the community. We've actually done very little to go after legislative dollars or private donors, which is something that I think we are going to start looking at because we need all the support that we can get at this point. But it is going to be challenging, I think, the next year or two.
Well, where are you? Madam Mayor, remember the charities deserve the money. And I understand they're they're replenishing the supply of money this year. An extra $1 billion should go a long way. That's an increase in that budget. Let's talk about the new mental health facility that is going to be available soon.
Yeah, so a bond referendum in 2004 kind of started this project. So it's 22 years in the making, and it was really championed by retired Judge Leifman. So it's kind of known as the Leifman Building. He really poured his blood, sweat, and tears into it, and we were very honored to be awarded the contract to provide those services: crisis stabilization, detox facility. There's actually going to be a courtroom in there because one of the challenges is a lot of the support outside of this building. It's, to try and connect people as they're going through mental health crises to, you got to go over here to get this support. Everything in this building is going to be, it's going to be a one-stop shop. So we're very excited. We're honored to be able to provide those services, and we're hoping that facility is going to be open up in 2027.
That's right around the corner, hopefully earlier than later 27. Let's talk about what's happening out on the streets with the homeless population and people that are unsheltered. I think there's a whole bunch of sterilized words that are out there. Let's talk about that. And what is the county and what can we do so that we can provide care for them? And where do they go? Because a lot of people, the only thing they know is at the stoplight, and then they sort of forget about it as soon as it turns green.
You want to take that one?
Yeah. So what this facility is going to provide is exactly for that. So individuals, what Judge Leifman was seeing was individuals were being arrested for low-level offenses, mainly due to their mental health condition, and they'd come to his courtroom, and then he would see them every, 6 months, every year. And in his mind, there's got to be something better because they're not getting the treatment that they need at the jails. In jail, they're not getting that treatment.
So just so people know, they would go into the jail system and they could get whatever care the jailers could provide for them.
Right. And, what we're able to provide is a professional clinical support, mental health clinicians that have the ability to be able to provide all the wraparound services so these individuals can not only get better, but then also make sure we're linking them to services and providing those services so then they can go out. And I mean, as we know here, especially in South Florida, it's hard to pay rent. It's hard to get a home. It's hard to make ends meet. So we are going to be providing connecting them with these services. So not only are they going to get better mentally, but the hope is that they can, reacclimate into society and, be able to live a great life with their friends and family.
So, Gloria, we know when these people are out on the street, it's a long way from being on the street to being able to get employed someplace.
Yes.
So tell us what you all can do to help somebody, at least give them a chance that they could get reincorporated.
I think the first piece is taking care of their mental health. right? You come into the facility, you get the treatment that you need, you get stabilized. And then once you stabilize, you start moving into the transitional process where it's transitional housing, job skills, resources. You're not going to just come into a hospital and then you're going to be discharged, 30, 60, whatever, 90 days later. You're going to be there with us for a little bit of time in order to get yourself back on your feet. And we're going to do our best to support them long term in terms of somebody's always going to be in their corner. And I think that's what's been missing.
So we know the Miami-Dade counties struggle with that about what to do, and it was just concerning the homeless, unsheltered hotel, if you will, down in Cutler Bay. That was a big stink. And what wound up happening is everybody agreed that they were going to be, excuse me if I got it wrong, over the age of 50 and no longer on alcohol or drugs. And so that was sort of a balance that was in there. But what do we do about the ones that you know that are alcoholics or they're on drugs? And that's the part I don't understand. If they don't have money, all right? And I know somebody in the room could tell us, but if you don't have money, how do you buy drugs? Or you don't have money because you're buying drugs? How does that work?
I think it's so complicated and complex that there's not going to be any story that's the same, right? You have, some of our parents, for example, that come through the foster care system, they're trafficking themselves. That's how they're getting the money to, buy whatever the substance is. That could be one scenario. Another scenario is that...
Just so people understand, tell us what you mean by trafficking themselves.
Human trafficking. So sex slave, labor slave.
Okay.
A lot of... It's unfortunate, but that's the reality that we're living in. And so, again, I can't really say every situation is the same, but that's one scenario that's how to get money.
And I just wanted to mention, I think what Gloria, said that, you speak to somebody, every story is going to be probably a little different. I think that's the one thing, when I started working for WestCare, it's been about 3 years. There's never it's not black and white. It's not, this is how it's going to go. It's a perfect, straight line. There's so many things that are going to come up. Every story is going to be different. Every story is going to be unique. And when when you hear the term, everything's a lot of things, it's case by case. That's really what each case is going to be so different from the next one.
And let's talk a little bit about foster care. These are young people that could be from a year old to...
birth to 18.
Right? Mm-hmm. And so here they are just barely at the beginning. And you know that when you're looking at them. It's not like he's as old as Miller sitting over there, all right? With their whole life in front of them. Tell me the kind of pressure that puts on you. Is he smiling over there? I'm not looking at him on purpose. What is that like for you saying, we need to help this little girl, this little boy, all right, so that he has a chance to grow up?
It's very interesting that you mentioned the child, but really it's a system, right? It's a family system. We really need to help the parent. The parent, essentially, once a child goes into foster care, that child is with a loving family or a relative, or their needs and their safety is already being provided. But what happens to those parents, right? How do we really help a parent that maybe went through foster care themselves? How do we help a parent that maybe lived in a domestic violence situation or had a parent that did substances themselves? How do we break those intergenerational cycles? That's what we really have to fix, right? As a community, as a system, we have to have a little more empathy for some of these parents, because we don't. We just see them like, oh, this parent abused this child. Well, I don't think anybody wakes up and says, oh, I'm going to abuse my child today. And so as a community, we have to start thinking more on the macro level. How do we get this family system and dynamic back intact?
So you have these kids. Does the county go get these kids? Does the court system say, listen, you can't have this baby or this child anymore. We're going to take them for a while until you get better?
Yeah, it's the Department of Children and Families. There's a call that comes into the abuse hotline. There's a CPI that goes and investigates. If they find that there's probable cause for a child that they can see is being abused or something's going on, they do remove the child, and then they have to go to court the next day and prove the case. And then the judge says, yes, this child is going to, stay in foster care, or no, there wasn't probable cause, they go home. So again, case by case.
For people that are not in the system, that it can only look from the outside in, how surprised are folks when they hear some of the stories that you are faced with every day? Tell us about that.
Yeah. So, I'm someone that started at WestCare 3 years ago. I was not part of, not a therapist before this. Really was not in the behavioral health space prior to this. So this is, was new to me when I first started. And it's interesting because when I go out and I'm really sharing the story about WestCare, the Village South, and what we do, whether it's in Broward County or Miami-Dade County. A lot of people that don't know about this, are not familiar with this. They say a lot of times, I had no idea this stuff is so close to home. Oh yeah, you kind of sometimes see about this, you watch a movie, you see it on the news somewhere else, but that this stuff is actually going on in our backyard. I think it's eye-opening, and that's where you get, we get a lot of support when it comes to providing toys for the families, making sure we have school supplies. We get a lot of support because people are, surprised that this stuff is happening in their backyard.
So, Gloria, a couple of Christmases ago, Grant went with a whole bunch of tennis shoes and a camera, and he went downtown under the bridges. When he left, he was feeling pretty good. When he came back, his eyes were like this big. He was astonished about how people are, we use the term living, under the bridge. Mm-hmm. It's more significant than most of us even want to look at. So if somebody wanted to help and they go, I want to help, what can they do?
There's a lot of different ways they can help. They can volunteer. They can be mentors. Of course, we would always love donors. We can always use financial support. But really and truly, there's always something for somebody to do. They could be part of Christmas parties, back to school drives, helping us put backpacks together, hygiene kits. There's always a need that we need to fill, always.
So we know that Ron Book and the entire county's worked a lot on this, and there seem to be less people out on the streets. Maybe they're not, but it seems that way. You have any count on that? And what would the average person say?
I'll be honest, I don't have a count on that. I don't know if Gloria has an idea.
No.
Yeah.
Not too long ago, I was at Pembroke Expressway, 103rd Street, getting off to take a left to go west. And on the side of the road that's on the ramp, there was a woman, a man, and a 5-year-old baby sleeping on the grass. It couldn't have been 7 feet from my front left tire. Ugh. People say, how could you help them? I said, there's a baby sitting there. They might be using it for drugs, but you know what? That baby needs to eat. And so often that we want to do that. And so, and if somebody wants to donate money, they could donate to you. There are plenty of charities that they can do that. Yes. And if there's a certain place they want it to go, listen, I want this for the women or for the drug or alcohol, can they say that?
Yes, absolutely. They could designate their donation to whatever they want.
So, So we're fortunate that the county has reinstituted, this is what I was told, all the charity money from last year, they are putting it back. I hope that the county decides. All right? We're not talking about a contract. We're talking about grants where they give you that money. Because we know the service that you provide is significant. There was a young lady who's down at Homestead. She came here and she told her story. She said, Michael, by the time I was 16, I had already been at 3 migrant camps, Homestead, if it sounds familiar, Texas, and Pennsylvania. She says, I was abused in 2 different places. Somebody helped me and went to Miami-Dade. Then I went to Barry. And then she got a 4-year full-ride scholarship to Case Western. She said, Michael, I was 20 miles from where I used to pick potatoes. Well, she got money to open up a healthcare facility, social service down in Homestead. And Mackenzie Scott Bezos gave her a lot of money, 7 figures, you know who I'm talking about? It was really significant when I heard it. And she ended the show like this. She points to the camera. If you've been sexually abused, it is not your fault, all right? You're not alone, and call me. And whenever I do these shows, I know that there's a story there. And then when I heard her say that, she struggled to say that because here she is, I don't know, she's 45, I guess, maybe 50, and still it impacts that. So tell us about who's more psychologically oriented. They're looking at each other. Tell us about the impact that it is when these kids are there, or the adults, the parents, when they get better, whatever that means, meaning they're going through your system. What's it like for you? Say they got in here and we were able to help them.
Yeah, I mean, I think that's in the end. We talk about contracts, we talk about grants, we talk about providing these services. In the end, that what we're talking about when they go through our program and we hear the success story, I mean, that's what it's all about. It's and I will truly believe this. I don't think there's another sector that puts in as many hours as our sector. We run a residential facility in Pembroke Pines. I mean, it's a 24/7 facility. There's always something going on. It is hard work. It's long hours, but it's for that person. When you hear a success story, that person that comes back and says, thank you for not giving up on me. Thank you for believing in me, maybe when I didn't believe in myself. I think that's what it's there. That's what, for me, that's what that's why I want to put in the long hours and work hard, is to hear those success stories, to hear that people were able to change their lives for the better.
And Gloria, you could have done so many things. You come from a family of people of giving of their time, and I think money also, but of their time. Why did you join WestCare Village South?
That's a loaded question. I've been in child welfare for 25 years. I started as a case manager, became a therapist, and it's just the work that they do really aligns with where my heart is at. So this is not work for me. This is every day I wake up and I'm like, what are we going to do today to change even just a little bit of somebody's life? And that's why I joined. They do a lot of work with women, children, with people that are experiencing things that others don't even think exist around us. So that's why I came over.
And what about yourself?
It's the opportunity. What we like to say is we're uplifting the human spirit. And when I think about being able to do that, to uplift the human spirit, we're truly changing people's lives here. And a little bit about our Broward facility. It is one of the only ones, it's the only one in Broward County. It's one of the only ones in the state that actually allows children to stay with their mothers as their mothers are going through recovery. So if that wasn't a possibility, you'd have, the families would be separated. You'd have maybe mothers that didn't want to go for treatment. So having their children with them, statistically, it's shown that they're going to have a better outcome with having their child there. And we're one of the only ones in Florida that provides that service.
As I said earlier, there's it's a recovery center. What is it? Where people can get help. All right. They told me they have 100 meetings a month. This one facility where different groups go there, and they're there for a half an hour or whatever it is. And the other night there was 75 to 100 cars there. I don't know if that was a regular night or a medallion night, but so many people are impacted by the frailties of life that for the services that you provide. It must be not too far away from any person. It must be all the time, everywhere. So you come from a therapeutic background. So what is it like for you when you look and say, oh my God, it's everywhere, which is life. So, and when you sit down with somebody and you talk to them, it may be just on this administrative level, but you can feel their pain inside. So how do you personally get through that? How do you still be empathetic without absorbing all of that?
That took years of practice. For many, many years, I would go home and cry and be sad. And oh my God, how do I wanted to save everybody. But the reality is that I can only do so much. It has to come from the person, right? You want to change your life. So I was just an instrument that was there at that moment to help them get to that next level. But honestly, it took many years of almost therapy for myself, and doing exercise and just accepting that I can't fix everything and fix everybody.
But you like to,
Yeah,
of course.
I want to help.
All right. So if you could push a magic button and you say, this is what I'd like to see happen, the service that we'd like to be able to provide for the people in Miami-Dade and Broward, of course, throughout the whole WestCare system, which have facilities all over the country. But for services here, because that's what we most care about, Dade and Broward, what magic button could you push and say, if we have this, these are some of the services that we could provide? What would that be?
Yeah, so we spoke about Miami and the facility that's going to be opening up next year. We're also in the process of raising funds to open up a very similar facility in Broward County, in Pembroke Pines, that will also have a crisis stabilization unit, a detox facility, and short-term residential treatment. So that's going to, once we get that building open, that's going to serve nearly 1,500 people every year. And that's just going to, the amount of services that it's going to come out of there, really being able to change the system, not just putting, maybe a Band-Aid on something, but this facility is going to be a real transformational game changer for the South Broward area. So being able to get support to open up that facility would be incredible, because it's very interesting. We actually have, once the facility is built and renovated, we have operating dollars to be able to provide those services. So we're just right now working on getting funding to build the facility, and then you'll see a big difference in the system of care.
Gloria, do your pitch for some money. Who do you want to talk to today?
Anybody that has a heart and that really wants to see a change in the community, because these are the homeless that you see on the side of the road. These are the parents the children are in foster care. These are the mothers that are being human trafficked. So anybody that has a desire to really be the change that they want to see in their community, those are the people that I want to talk to.
I do want to brag on my brother for a minute. A couple of years ago, there was a major football game about to happen here, and there was a big party boat that was out there. Grant went there with a camera. And he said, "Where are you in Miami Herald? Where are you? Radio station, where are you? Where's Channel 4, 710? Where are you to stop what is about to happen from happening?" And the good news is the media responded and put enough pressure on the politicians so they didn't have to do that, because for sure there was going to be a problem with that. So we just have a couple of minutes to go. We're going to start with you, Dustin. Why don't you look in that camera right over there? Where is it? Over there. And why don't you think about some people that have helped you along your way? They could be still with us, or maybe they've passed. If you'd like to thank them, that would be great. And if you want to mention by name, that would be wonderful too. You're up next, sweetheart.
Are we talking personally or professionally?
Yes.
Okay. Yeah, for me, I moved here to Florida when I was 9 years old. And so I got to thank my parents for giving me the opportunity to live here in South Florida, a place that I absolutely love. Was very blessed to be able to continue my education, go to college at the University of Central Florida, get my master's degree right down here at St. Thomas University. My parents gave me the opportunity to really follow my dreams, to be able to also play college tennis, which was very important to me. And then when I got done with school, I wanted to really feel like I was making a difference in someone's life. And thanks to several jobs that I had before this, and then this job here with WestCare the Village South, my supervisor, our chief development officer, Scott Falkenberry, gave me that opportunity to come on board here. Danny Blanco, who is our chief operating officer for WestCare Florida, has just been incredible. His support, his belief in the work that we do. So I'm grateful for the two of them for believing in me and putting me in this position to be here today.
Wonderful. Gloria, you're up. Look in the camera over there.
So a lot of people don't know my story. I don't really share this, so this is interesting that I chose today to do this. But I came in to this field because of my experience, right? My mother was a single mother. We lived through a lot of domestic violence from my father. And so as a child, I decided that I didn't want any child to go through what I went through. And so that's why I'm in the role that I'm in. That's why I studied what I studied. That's why I've been 25 years in the grind, so to speak. So I've had an amazing mother. I'm fortunate to have an amazing husband, family, children, and a lot of mentors along the way that I'm not going to start mentioning a million people, but you know who you are. I'm just grateful for everything that I've experienced and that I could give back.
Wonderful. Thank you for sharing that.
Of course.
Dustin, thank you for serving, and thank you for doing that. Gloria, thank you. And we're going to look right in this camera right over here, the smaller one. Thank you for joining us. Remember, if you need some help, call WestCare Village South. We have the phone number once you run it again up there. And my brother Grant and I subscribe to the Disney rule, which is when you hug someone, don't stop until they do. Bye now.